Well, wrapping there are several different types of wrapping. One of the type of wrapping, which is very standard, is basically to stabilize the joint, which is hypermobile. That means the joint is moving more than its normal range of motion. That's commonly we use wrapping for that purposes. But there are other reasons that we wrap or we basically dress the part of the body which is injured. And a couple of those types are kinesiotapes or kinesio-type wrapping, which is, again, gives the patient the mobility, but also is more protective, re-injuring the joint itself. So kinesiotapes applied on the body or on the joint that is injured and basically gives that joint extra support throughout its normal activity of the daily living of that person. And lastly, the type of a dressing or wrapping would be topical ointments that usually we use. They create a mixture of maybe 5 or 6 or 7 different ointments that helps to reduce the inflammation, reduce the pain, and promote healing. There is no best type of a wrapping. All these 3 ways of wrapping or dressing the body part has to be done based on the diagnosis and what we find the condition of the patient is. But depending on the injury, depending on the chronicity or acuity of the patient's injury, all of those things prompts us to use different type of wrapping to best accommodate the patient.